Hi, you're welcome back to my YouTube channel Skin and All. So the first video on this channel about the skin, we talked about pseudofolliculitis, the annoying buggers that come out after shaving, those annoying shaving bumps. Today we are going to be talking about basic skincare for the black skin. What really makes the black skin special? Is skincare really different when you compare black skin, Caucasian skin? Are there steps that you must take that will be different from, from the general care when it comes to the black skin? So these are all the issues we'll be addressing in this video today. And there's something that I have for you at the end of this video. We're going to be talking about acne. I've spoken about it several times on all of my social media handles. But today, we're going to do an extensive review on acne. And the reason why we are going to have that extensive review is because acne is a big problem. Up to 85 to 90% of people would experience acne at some point in their life. So, without further ado, let's move on to care of the black skin. So, is there anything that makes the black skin special? When you compare black and Caucasian skin, we come in our different shades, our different colors. And so the major thing about black skin is our melanin, the type of melanin that we have. And this is what determines the kind of skin color that we have and how close we are to the equator, or how far you are to the equator. Those are some of the things that determine the skin color that you have. So the type of melanin that we have is called eumelanin. It's a darker form of melanin, and the way our melanin is packed in some certain things that are larger. And so most of the time, when we heal in our skin, when we have any injury on our skin, when we have any skin reaction that has taken place, we tend to heal with something we call post-inflammatory hyperpigmentation. When you hear the word hyper in dermatology, hyper is too much. So post-inflammatory hyperpigmentation just refers to when you have a skin issue that has occurred, usually an inflammatory one, and you now have a darker skin color than the regular shade that you have. Sometimes we can heal with post-inflammatory hypopigmentation. And hypopigmentation, remember what I told you, if hyper is too much, hypo means is too little. So post-inflammatory hypopigmentation just means that the skin is, healing with a lighter shade than the regular skin. So whether it is darker or lighter, none is particularly palatable to the black skin. And a major issue of black skin is this post-inflammatory hyperpigmentation that I've talked about. So generally, people talk about the black skin. Is it really different? The care of it, is it really different from other skin types? So the basic care of most skin types are actually really similar. So you start with something we call cleansing. And when we say cleansing, your skin produces a lot of oil. There's what we call the sebaceous glands. The sebaceous glands on the skin, they're that gland that produces oil on the skin. It's the gland that produces oil on the skin. And this gland is in abundance on the face, on the scalp, on the chest, on the shoulders, on the back. So you'll notice that even when other areas of your body, when they are not oily, you have oil on your face, especially if you have oily skin. So when you are cleansing your skin, you are cleansing your skin of the impurities, the oil, some of the debris that has collected on the skin. So when we say cleansing the skin, a lot of people think, especially Nigerians, we like using sponge and we like scrubbing the body. Scrubbing the body it's not necessary in ensuring that your skin is clean. Because when you are cleansing your skin, the skin has a pH that the normal pH of the skin. So the pH of the skin, you remember when they were teaching all these things in chemistry and all that, the pH of the skin is slightly acidic, between about 4.5 to 5.5. So when we are talking about cleansing, we are just talking about ensuring that when you are cleaning these impurities from the skin, you are leaving the pH of your skin unaltered. When you cleanse your skin with harsh things, you tend to, and a lot of the soaps we have around, a lot of those soaps that you use in bathing, a lot of them are alkaline. And when you use them on your skin, you alter the pH of your skin most times. And one myth that I'm going to break now that you'll be so surprised is that the foam is not what is really cleaning the skin. So the foam is actually put there for your, for your psyche, to make you feel like you are cleaning your skin properly. And a lot of Nigerians, if that thing is not foaming, I'm sure they don't believe it is working. So I'm here to tell you that it's not really the foam. But if you like the foam, continue. So another thing I need to let you know is that using antibacterial soaps, antiseptic soaps, they are not encouraged for your regular care of the skin. The reason is because when you look at our skin, there's no part of the body that does not have its own flora, except for some certain areas. Some certain areas of the body, they don't have any bacteria in them. But the skin has its own normal flora. And when we say normal flora, that's the normal healthy bacteria that nature has put on your skin. And there's one Yoruba adage, it says that àìsínlé ológbò, ilé dilé èkúté. That means that the absence of the cat, it makes the mice, it makes them come out to play. So when you take away the normal flora on your skin with antibacterial soaps or antiseptics, then the abnormal bacteria start to grow. So the normal bacteria, they are living there. You guys are cohabiting, no problem. But the moment you start to take them out with antiseptic soap, then you are inviting trouble. You may wonder why all these antiseptic soap are all over the place. It is because that there are still some conditions that they are necessary to use. Okay, an example is one condition that we call scabies. So if I'm treating an infestation on the skin called scabies, that thing that causes the stop rash that makes you scratch your skin like no man's business. When I'm treating that condition, I want to take away all the mites on the skin. So I'm going to use an antibacterial soap. But regularly, you don't need to use an antibacterial soap. Myth busted, right? Anyway, so mild toilet soaps. For me, and it's one joke they say here around here in Nigeria, that dermatologists, they love Dove moisturizing soap. We love it because it's kind of balanced for the skin. It's readily available and you don't have to be looking for it all over the place. You really don't have to worry so much about a lot of fakes in the market. So especially when you are getting it from a reputable place. So for my family, all of us in our family, we use Dove moisturizing soap. And let me make you laugh. I had been telling my husband that Dove is the best. Dove is what you should, not the best. I'm not doing any advert or anything presently, but that's what we use in my family. So I was telling my husband that Dove is good. Let's stick to this. But it has this feeling of feeling slimy when you first use it, especially when you're not a regular user. So initially, he didn't want to, but by the time he went abroad, he went for holiday, and he met someone, and the person told him that, oh, Dove is what my family uses, or this mild toilet soap, and you won't believe he started using it after that. Just talk about a prophet having no honor in his own home. So it doesn't have to be Dove. Just mild toilet soaps are fine for your skin. You don't have to put any antiseptics. Then when you want to wash your face, you're looking for hydrating, you're looking for cleansers. Cleansers that may contain ceramides, some of them contain glycerol. And so you're looking for mild cleansers that would be pH balanced for your skin. I use CeraVe when I'm not breaking out. And this CeraVe, this one is actually for normal to dry skin. This is actually not what I'm supposed to be using. I'm supposed to be using the one for normal to oily skin because I have really oily skin. But I got this one because that was the only thing I got in the market then. And I kind of like it. It's okay for my skin. So most of these cleansers, they don't foam, especially when you're when you're using it on your face. But it cleanses the skin nicely without drying it out. So remember, I told you the first step is to cleanse your skin. And so the next step, I'm going to mention 3 basic steps, and I'll add a 4th one. There are other things that you can add, toning, but the 3 basic steps that are essential. You cleanse your skin, you moisturize your skin, you make sure that you use a sunscreen with sun protective factor of between 30 to 50. Anything below 30 is not protecting you enough. And once it's more than 50, is what we call oversabi, like it's too much. It's not too much, but no real added benefits above 50. So just make sure it's between 30 to 50 when you're using your sunscreen. And remember, when you want to moisturize your skin, so this is the present moisturizer I'm using. Like I mentioned, I have oily skin. So I'm using this tea tree moisturizer, and tea tree is very good for oily skin. So this is the moisturizer I'm using presently. And like I told you, you cleanse your skin, you moisturize, and after that, I use my sunscreen. Presently, I'm using Elta Md Sunscreen. And so this is the one I'd like to focus on just a little bit more. black skin generally, so this is where we differ from Caucasian skin when it comes to selecting sunscreen. We have different types of sunscreen, the physical blockers, the chemical blockers. And so using the layman language, physical blockers are actually physically blocking those UV rays away. Chemical blockers, those chemicals in them, they have this chemical reaction they have with this UV, and they prevent it from, getting into your skin. So this is Elta Md Sunscreen. It contains zinc oxide and it's a physical blocker. So the acceptability of the sunscreen, whether physical blocker, whether chemical blocker, anyone is fine for the black skin. But the acceptability of a sunscreen for black skin is the amount of residue it leaves behind. For Caucasian skin, a lot of them, when they apply the sunscreen, even if it is white, it blends into their skin nicely. But for us, you don't want to look like Ojuju Calabar to work. And when you want to use your sunscreen, you're looking at your 2 fingers are covered with the sunscreen. And see, my sunscreen is almost finished. And so you want something that is not leaving residue. So this is Elta Md Sunscreen. I'm using it on my face. I've used it already this morning, but can you see? I'm rubbing it in all the way. Can you see that? Can you see how it blends in nicely into my skin? So a lot of people are not using sunscreens because they worry about the fact that it doesn't blend well into their skin. They don't like the fact that it leaves a white cast. And so the problem is because you have not gotten the ideal sunscreen for you. So I've put this sunscreen all over my face, and I have powder on my face, yet it has blended well into my skin. So for black skin, don't think that sunscreen is not important in your routine. You need to use a sunscreen because it's not just protecting you against sun-induced skin cancers. It is protecting you against sun-induced aging. We talk about photoaging. If you see someone that has been using a sunscreen regularly compared to somebody that has never used a sunscreen all their life, both black skinned, you would appreciate the difference. Because the person that has not used sunscreen will have a lot of wrinkles, aging, looks older than they are supposed to be. I look like 20, right? I look like I'm just 21, right? And that's because I've been using the sunscreen regularly. So for black skin, there's another sunscreen I have, a Mysha Sunscreen. And this is also, it contains a physical blocker too. So these sunscreens are acceptable for my, so it's not like one is superior over the other when it comes to sunscreen. It's just that you must make sure that you have one that is not leaving white cast or residue on your skin, and you should ensure that you reapply your sunscreen at least, let's say, every 4 hours. I know that's a lot to ask of us here, especially with the weather and all that. But honestly, once you start it, you will see that your skin will be better for it. So cleanse, moisturize, and then use your sunscreen. And after that, I don't use brown powder every day. What I use any of this oil control white powder, talcum powder, like Pond's white powder. And when I use it, one trick to it, a lot of patients ask me that, Dr. Gold, after I'm done applying all these products on my face, my face feels so oily, it's like there's a lot of residue. I tell them, just use the white powder. Powder absorbs oil from the skin. So once it absorbs the oil, you'll see that the oil on the skin calms down. So those are the 3 basic steps for caring for the skin. Then you can now start adding other things. If you're over 30, you add an antioxidant. You can add retinol to your routine. So this is a retinol cream that I added to my routine by Marianne. So it's not, and when you talk about products, the acceptability of a product depends on the active ingredient you're looking out for, in the product, and if your skin does not react to it. So if you are using, no matter how widely acclaimed the product has been said to be, if your skin reacts to it, then it is not for you. Because I see a lot of people making that mistake. Oh, there's this niacinamide by this product and everybody's raving about it. But when I use it, I get some skin irritation. And I tried, once I stop it, the skin irritation stops. That means it's not for you. You probably need to try another brand. So talking about one brand being superior to the other, not so much. Most of the time, look out for the active ingredient you are aiming for. So if you want niacinamide, you want vitamin C, depends on what you're trying to manage on your skin. So cleanse your skin, moisturize your skin, use your sunscreen, and add some antioxidants, especially after the age of 30, 35. So we've been talking about basic skincare for the black skin, and I hope you are more enlightened now. I told you that we are going to talk about acne before the end of this session, because half of the patients that come to my clinic that are in their adolescent years or young adults, they come with the complaints of acne. So it's a problem that affects a lot of people. And now I'm seeing a lot of patients with adult acne. Adult acne refers to acne in anybody over the age of 25 years. So whether it started in adolescence and persisted to after 25, or whether it started in adolescence, you had remission and it started all over again, or it started after 25, it is still adult acne. I have adult acne, by the way. Just imagine, acne has no respect, even for me as a dermatologist. So it's a major problem affecting a lot of people. So these are some of the products that are good for acne. And so note that I'm not telling you one product in this review is superior to the other. I'm just giving you some of the active ingredients, and they just happen to be the products I have presently. When you're managing acne, when you have active lesions, when your acne is a bit active, you are aiming for things like benzoyl peroxide, usually between 2.5 to 10%. But for most patients, based on experience and based on a lot of patient reviews, most patients tolerate between 2.5 to 5%. A lot of products of acne can be irritating to the skin, especially benzoyl peroxide and the retinol. So you start with benzoyl peroxide. You can have a cleanser. So instead of the regular cleanser that I mentioned before, you can have a cleanser that has 5%, 2.5% benzoyl peroxide, or even 10% if your face tolerates it. You use it and you stay in front of your mirror or just in your bathroom in circular motions, and you do that for about 1 to 2 minutes. 1 minute, I can't do 2 minutes every day, but so between 1 to 2 minutes, you wash your face and you rinse it off. And after that, you need to have an on-the-spot treatment. And so here, a lot of patients, sometimes I combine both 5% benzoyl peroxide as a cleanser to wash the face and also as an on-the-spot treatment. But I tend to use, drugs with different mechanism of actions. So I tend to use salicylic acid as an on-the-spot treatment. So when they say on-the-spot treatment for acne, you are applying that on the pimples, on the acne itself in the morning. So for example, this is a 2.5% benzoyl peroxide cream. You just apply it on the lesions in the morning. And after applying, it's better to do it in front of a mirror because it can leave a white cast on your face. So make sure you blend it in. And just immediately after that, you ensure you use your moisturizer. Okay? Make sure you are moisturizing your skin if you are treating acne, because if you don't, your face gets too dry. You start to even get more oil on the skin because the skin senses it as the face being too dry. Then you moisturize your skin. Then what's next on the step? Yes, you said it and you're correct. Next, you use your sunscreen. So after using your sunscreen, then that's good for that. You're good on that. But in some cases, and that depends on how much you have, how much you can afford, you may institute some serum like niacinamide serum just before your sunscreen into your regimen. At night, then remember to reapply your sunscreen, like I said. At night, you wash your face. And sometimes I just balance it, just not to dry out the skin too much. So instead of using the benzoyl peroxide at night, sometimes I just use a mild wash like this at night instead. And benzoyl peroxide and retinol, you shouldn't be using them together because one inactivates the other. So when you wash your face at night with this, then a prescription retinol, this one you need your doctor to prescribe to you. The common one you will find in this environment is Retin A that contains 0.05% tretinoin cream. And you apply it all over your face lightly at night. So this is one of the products that can cause irritation and dryness with acne patients. But the trick to it is to start gentle. So most times you can start with 2 to 3 times a week and increase gradually. A lot of patients, they think that when I load everything on, use all the products together, then I'm going to get better. No, slow and steady. Anything about the skin, you are better off with a lot of TLC, tender loving care. That's what the skin likes. So with the retinol product, you start gently and you start like 2 to 3 times a week and you increase gradually. In fact, this is one of the most powerful products when you're managing acne. Very good. It helps almost all steps that are involved in the etiology, that's what we call it, of acne. So you apply this all over the face, not as an on-the-spot treatment. And let me tell you one secret. Most people with acne, the reason why they tend to have a lot of relapses is because once they are done and the acne clears off, they stop all their products completely. That's one thing you should not do. Please, if you have acne, and especially if you have adult acne, make sure you continue with your retinol. You might not even be a prescription one. You might go to the over-the-counter retinol product. Make sure you always have your products handy. Benzoyl peroxide, salicylic acid. So even when you're not using them anymore, especially the on-the-spot treatment, because that one you stop using them once the acne has calmed down. Even when you're not using them anymore, make sure you have it handy so that when new ones start to come out, you make sure you apply them before it becomes a full-blown relapse. So I'm sure that you have learned a lot in this video. We've talked about basic skincare for the black and all you scrubbers that keep scrubbing your skin. And you know that you really, especially with the children, you really don't need to bathe them like 2-3 times a day because you are drying out their skin. One way, if you insist that you must bathe them 2 times a day, one thing you can do to reduce the drying is that when you finish bathing them, moisturize their skin. And by moisturize, Nigerians, I mean apply body cream. Don't look ashy. The skin that you take care of in your growing up years is the one that will take care of you later on. So stay tuned and keep watching Skin and All YouTube channel. Have you subscribed to my channel? Click the like button and please subscribe to my YouTube channel. See you next time.